seizure is about 65 to 70%. So you do need to be on medication, but we have to get you on the right medication at the right dose, okay? So that you
Okay.
don't have side effects. That's what our role is going to be over here. Okay.
Okay.
So Keppra can cause moodiness and some drowsiness.
Yeah.
One avenue of of getting around that is by starting you on a vitamin called vitamin B6. It's 100 milligram once a day.
Oh.
That takes the edge off the side effects of the Keppra. Okay.
Okay.
So I'm going to prescribe that. You can also get it over the counter, vitamin B6, 100 milligrams once a day. But
Okay.
okay. And the way you're going to take your Keppra, you're on a 500 milligram dose, which you're taking at night, right?
Okay.
You're
Yes.
going to split it into two. You're going to take 250 in the morning and 250 at night.
You tried that.
Okay.
You tried that already.
Right.
You know, it didn't go real well.
No, it's.
So what I would do is probably start your vitamin B6, let it be on for about a week, and then try this morning evening thing. Okay.
Okay.
Yeah.
All
Okay.
right? And then you'll give us a call if you're not doing well on the Keppra. Then we can replace it with another medication. Okay.
Mm.
The one medication that we can replace it with is called Lyrica. Have you heard of that?
Not really.
Okay. So Lyrica is another safe medication for seizures. Just like Keppra, it does not harm any body systems. Okay. And it can be taken twice a day. So if we get to that stage, we'll get you there. Okay. And then we'll go from there. So you'll take vitamin B6 for about a week, then go to 250 morning, 250 evening, and see in about a week if you're feeling better. If you're not, then give us a call. Okay.
Okay.
Did you have any other questions for me?
I guess from the testing this morning, is there any follow-up or?
Yeah. So the MRI showed those old strokes that you had. That's what it showed.
Mm-hmm.
Oh.
EEG showed slowing and sharpness in those same regions where you've had a stroke. So what happens is that your brain cells talk to one another by electrical discharges. Okay? When you have a stroke, it causes scar tissue over there, right? So when the electrical discharge is coming there, it gets to the scar tissue, it short circuits. So that sets up an electrical storm, which is what a seizure is. Okay?
Mm.
So what do medications do? They calm the currents down so they're not big enough to short circuit and cause a seizure.
Oh.
Do you understand what's going on now?
Yeah. Yeah.
And one question I had just from an environmental, because we want to try and limit these, and I was wondering if stress in the environment. So when she had this, my mom was out. My mom was causing her a lot of anxiety, and I just wonder if the stress in the environment is a key in something like this or not.
So we don't have good studies to show that stress would cause seizures, but let me tell you, I have a ton. I treat about 4,500 patients with seizures, right?
Mm-hmm.
Some of them tell me that stress does affect it. The one way we know it can affect it is because when you're stressed out, you hyperventilate. You don't know that you're hyperventilating. And when you hyperventilate, it changes the chemicals in your brain and makes your brain more likely to seize. So in that way it is. So what I tell my patients is when you are in a stressful situation and you think you're getting stressed out, pay attention to your breathing, right? And try and do slow, deep breaths. Okay?
Okay.
Calm your brain down.
Yeah.
Okay?
Yeah.
Focus on your breathing and do slow, deep breaths, and that will prevent any of the ill effects on your brain.
Okay.
Okay? Any other questions that you all have?
B6, doctor, that's all?
We are going to do B6 for now, and after a week of B6, you will then try the morning, evening of the Keppra for about a week. If that doesn't work, you'll give us a call, and then we will make changes to yours. Carolyn Cotton is my epilepsy nurse coordinator. She'll be the one who'll be in touch with you. Okay?
Okay.
It's B6.
We'll get some B6. Yeah, Carolyn will help us.
I'll prescribe it today. I'll prescribe it today for you.
Okay. Thank you. Thank you.
So
okay. I think we're good then. Thank you. Nice to meet you.
Nice to meet you, and thank you, and we'll be in touch. And you'll come back and see me in about 4 months or so.
Okay.
All right. Thanks.
Thank you.
All right.
Take care.
Thanks. Bye-bye.
Bye.